Hello, I'm Dishi. Welcome to my lecture. Today I'm going to talk about health autonomy. Health autonomy is a central value in the Western medical ethics. Medical ethics can be traced to the age of Hippocratic oath, when in ancient Greece, new physicians swore to adhere to certain ethical standards in medical practices. In the United States, in 1960s and 1970s, medical ethics started to incorporate liberal theory with questions such as human rights in medical experiments or life support in ICU. Since then, medical ethics has been drastically shifted to a framework of four principles: autonomy, beneficence, non-maleficence, and respect to human rights. On top of that is autonomy. Autonomy, its core meaning is self-governance, and its notion differs as it is applied to different domains. In the domain of medical practice, autonomy is usually expressed as the right of competent adults to make informed decisions about their medical care. However, autonomy can conflict with the other medical ethics, such as conflict between autonomy and beneficence or conflict between autonomy and non-maleficence. So in private medical practices, health autonomy refers to patients' rights and abilities to make their own choices. In public health, autonomy also plays a critical role in health promotion or disease prevention. The big challenge is that making a balance between desire to improve public health outcome and individual freedom to maintain autonomy. A typical example could be a big tension in vaccines. Some parents reject measles vaccines for their children because they claim that the vaccine can cause autism, which is not based on adequate evidences. There's another emerging dilemma of autonomy in the public health. It's from the opiate epidemic. Patients who are addicted to painkillers ask for more and more drugs year by year, but physicians must be very careful to those requests in case pain treatment is abused. And the doctors are not able to control those drug misuse behaviors. Unfortunately, in 2017, drug overdose has caused more fatality than deaths caused by traffic accidents. So at the beginning, we talked about autonomy is defined as the right of competent adults to make informed decisions about their own medical care. Here, informed means that the patient's consent, which is required to obtain autonomous authorization. So here's some problems about health autonomy of older adults. Whether a patient is autonomous or not depends on a couple of factors. First, diseases or disabilities can weaken a patient's autonomous capacity. For example, dementia. Patients with dementia have diminished autonomy. Also, it's very difficult to measure autonomy accurately when the dementia is progressing because cognitive declining progresses in different rates to different individuals. Second, limitation of choices can restrict autonomy. For example, an older patient was given 2 different medical treatments choices in the clinic, but what he actually needs is a different location to receive services. False belief and the external influences can also affect individuals' autonomous capacity. Reductionism could be more popular among older adults. For instance, it is perceived that drinking coffee can prevent Parkinson's disease. If doctors suggest reduce caffeine intake, someone could not to be following, although it might not be a great decision. Apart from above, There are many struggles happening to trade off between personal safety and independence. For example, in a scenario, an older patient after surgery of hip replacement claims that he or she is well-being enough to go back home and living alone. So those are a brief overview of health autonomy in relation to public health and aging population. Thanks for watching. I hope they are helpful. Bye.